What I'd like to talk to you about today would be to look at why should we get concerned about occupational health and safety. Jim has elaborated on that to a great extent, so I think we're just going to assume that you all know why we're concerned about that. I want to talk about 6 primary health concerns that we see in production in swine production. Some on preventive measures. I want to talk about the Certified Safe Farm, which again is kind of an analogous type program with a couple of little different wrinkles that I want to mention about that. And then we worked with the pork producers back about 2 years ago to put together some training programs that we have canned on our website, and I want to just mention that and make sure that you are aware of that and have access to that. This is just a little bit more data to say that not only is health and safety issues a right thing to do, but it's an economical thing to do. And if we're talking about an individual type of an independent producer, people are paying for their health insurance upwards of $12,000 a year, which is obviously a big chunk of change. One of the things that we have been working on is if you can make your operation more safe and more healthful, then those insurance premiums should be reduced. And so we've been working with Wellmark, Blue Cross Blue Shield. We've been working with Allied Health Insurance to try to make sure that there's some value in health and safety that pays up front. That is really, I think, in the end going to be the big driver for everything that we have. So we know that it's economical, is valuable to do this thing as well as it's the right thing to do. We talk about the human capital in terms of livestock production or in agricultural production, generally speaking. We have big cash flow in these operations, but we don't often consider about what the human capital is component. And that's what Jim and I are talking about today, because we need to reduce health insurance costs. We need to reduce workers' comp costs. We need to reduce liability potential and disability potential and OSHA concerns, and we need to reduce sick leave. We need to keep employees on the job. What do you think the industry average is in terms of turnover every year in a larger operation? How many? What do you think that is? Sorry? Yeah, that's right. Sometimes I think the industry average is even a little bit higher than that. Jim, do you know offhand? But it's a big turnaround. It's a big turnover. And obviously, you got to retrain people. I mean, it's a cost, right? And so part of the deal is to try to keep people there that you've already trained. And a lot of that comes in being able to provide a health and safe and workplace for them to work. That improves worker morale. Hopefully that improves the bottom line. So all of these things are issues that really, I think, should be driving this issue. Here are 6 things I want to mention that are more health. I mean, injuries are, well, they're costly, they're bad, but they're very obvious. There's a lot of other health concerns that kind of fly under the radar a little bit because we don't see them until it's, maybe some years down the road or some months down the road until the exposure happens. So I want to talk a little bit about those. And I want you to ask questions, and I'm going to ask you some questions to see what you see out there as well, to make sure that we understand respiratory exposures, manure gases, injuries. I'm not going to talk much about injuries because Jim did a great job on that. Needle sticks, infections, noise exposure. Respiratory, this is what really got me interested in this whole business, because as a swine veterinarian and as my practice became more and more involved in intensive housing, I'd go home at night, I'd cough, I'd hack, I'd spit, and my chest would feel tight. And I got to the point where I really couldn't work in the buildings, even with a dust mask and so on and so forth. So that was one of the reasons that kind of drove me in this direction, and really started doing research in that area in the late 1970s, and we know a lot more than what we did back there, but we still have some issues because this is data from just the last couple of years of a large 600 farm population that we have had on study with this certified safe farm. So you can see that in terms of the numbers or percent of people working in swine production, their respiratory problems are up around 23%, 22, 23%, and relative to non-pork producers, which are down to about 13 and 14%, and that's quite highly statistically significant. So we still have a problem and an issue, and actually that hasn't changed a whole lot since we started getting involved in this. So we do have some work to go and have to realize. Now, most of these problems, I admit, are ones that don't happen overnight. They are things that happen over years period of time, 5, 6 years period of time. So just to mention that. But one of the things that has been, that we recognize is that the probability of individuals working in the facilities having a respiratory condition, one of these, depends on how much dust and gas they're exposed to. And we know that if folks are exposed on a daily basis to like more than 2.5 milligrams of dust, and if they're exposed to endotoxin, do you folks know, have you ever heard of endotoxin as a potential problem in buildings? Have you? No? You know what it is? Yes? No? Do this or this? No? Okay. Endotoxin is a component of gram-negative bacteria, a group of bacteria that don't take a particular type of stain. It's just a part of their cell wall, but it's also a very inflammatory substance that when we inhale it and it gets into our airways, that it causes a lot of inflammation and a lot of the hacking and coughing and chest tightness and so on that we see if you're exposed to it over long periods of time. It's also, well, from a veterinary standpoint, it's one of the things that kills critters. It's a big killer of horses, for example. If you get a horse that has a bowel stasis, that they're not moving stuff through their gastrointestinal tract, that endotoxin will build up at high levels, get into the bloodstream, and that's what kills them. So it is a very highly inflammatory substance, and we know now that when you inhale this stuff over long periods of time, it can be a problem. It's also a problem for pigs because if we get up to a certain level of that, we also bother pork production as well as total dust. And also ammonia levels. When we have higher than 7 parts per million, there's a problem for people. Higher than 11, a problem for production in pigs. And then look at the usual values that we see, wintertime values in most of our production units. It's not uncommon in most of, whether it's farrowing or nursery or finishing, to have about 6 milligrams of dust in the wintertime. So higher than the levels that we'd like to see. Endotoxin up 1,000 or so, higher than we'd like to see. And ammonia is usually not too bad. I mean, it's usually kind of under or close to about the levels that we would like to see, or not much higher than what we like to see. Let's put it that way. But an interesting thing that we know now, that when you have dust and ammonia together, you have more than twice the health risk as any one of those individually. They work together to cause a worse problem. So I do want to point that out. Mostly chronic exposures, mostly airway concerns in people, bronchitis, which is when you start hacking and coughing and spitting because your airways are inflamed, asthmatic-like conditions, so that your chest feels tight and you got kind of breathing like that a little bit. And then a condition called organic dust toxic syndrome, which many of you may have experienced and didn't know what it was. that particularly if you're sorting and moving hogs, one of the highest levels of exposures of when you're sorting and moving hogs and loading them out. You may, at that, there's people involved in that, if they're not wearing a respirator at the end of the day, may be feeling like they're getting the flu. They may have fevers, they get muscle aches and pains and headache, and the next day they might feel a little bit better and may take 2 or 3 days to get over that. Or if those of you who have been involved in grain production, cleaning out a grain bin, you know, either a soybean grain bin or a corn grain bin that's kind of moldy, and you stir up that. Anybody experience that type of thing? That's organic dust toxic syndrome. Doesn't necessarily mean that you're going to have a prolonged health problem from that, but you're going to likely have those episodes more frequently with a little less exposure. And that's the endotoxin that's doing that, causes that. So I wanted to point those out. And the cost of this, we know that about, as you saw in that previous slide, about 23% of producers have one or more of those types of symptoms that go on. So what does this mean over the long term? Well, we really don't know. We haven't followed people over the long haul. There was a Canadian study done a while back. Over a period of about 7 years or so, about 10% of the producers in this particular study had to get out of the business because of those respiratory conditions. So it is a factor to think about and to be aware of. How do we prevent it? We've done a lot of research on this over the years, as have others. One of the best things that you can do is power wash. Keep that dust level down every 3 to 4 weeks if you can, if that fits into the management system, because that will keep the overall dust levels much lower than if you don't power wash more frequently than that. The dust levels come up to a certain point, and then they start to level off, because what you're doing is every time you move and the movement of air in that building, it's recirculating that dust that settles out on the surface. So if you can reduce that, you can reduce the whole volume that's in the air. We've worked with a system that you can. How many of you have a system where you can pre-soak your building before you power wash it? Any involved in that? Have that system? You have that? An automatic system that you can pre-soak. So we've worked with a system that you can apply a small amount of a solution of soybean oil with a detergent in it. And doing that several times a week will cut that dust level in like about 70%. And then you can use the same system to pre-soak as well. So it works quite well, just as an example of one of the things that can be done. Education, to make sure that there are a lot of different kinds of source where the dust comes from. Just for example, in management alone, if the feed drops this far down into feeders and you've got feed dust boiling up out of there, well then lower the falling rate into that feeder will help reduce total amounts. Just very simple things like that. And then respirators. Not very many people wear respirators. And we don't necessarily, say, wear a respirator the first thing. We look at it as an adjunct. Because how many of you wear respirators here? Do you like it? No, you don't like it. They're uncomfortable. They collapse on your face. They're hard to breathe through. They're not fun. So people don't typically like to wear them. But we'd say that it's something that should be, if you can't get the levels down to where we'd like them, then it's probably something that should be considered. And let me back up here a minute if I can. What isn't happening to any great extent out in our production system is knowing what the exposures are. How many in here have ever taken measures or have measures taken in your facility to know what the dust levels or ammonia levels are? Anybody? That's a thing that we really would like to get involved and have that happen so you know what the exposures are. Then you can target your management systems and whatever interventions you can to keep the levels down to levels that we know are much more healthful for people and for the production of pork. So that's something that we really have been working on, is trying to get a system that's easy for people to take their own measurements to know what those exposure levels are. Manure gases. Probably everybody in this room has either had a direct experience or knows of somebody who has had a building where there's been a whole building of pigs that have died, right, because of gases. Anybody? Nobody else has? Everybody. I think sure you have. I mean, if you haven't, you're sitting on your hands or something, because we know it's too common. It's all too common, and it still happens. Well, I want to just review that, because coming here in another couple of months or so, we're going to start emptying these deep pits, right? And that's the problem. Whenever this liquid manure is agitated, that's the problem with hydrogen sulfide. And it is hydrogen sulfide gas that causes the problem. 40% of the pits that we have assessed out in sort of a randomized trial have enough hydrogen sulfide in that manure that if you agitate it at the right, with the proper, well, I shouldn't say proper, but if you agitate it at a fairly high level, you're going to potentially produce enough hydrogen sulfide that's going to kill pigs and people. So it's very common that happens. And it is in deeper pits because you have to have anaerobic conditions, so meaning that without oxygen, these organisms will end up as a byproduct producing hydrogen sulfide. So we're talking about pits that are 4 to 6 feet deep, deeper than 4 feet for the most part. And a lot of our pits are, 6 and 8 feet deep. Those are the ones that are a greater problem. If you have high sulfates in the water, and a lot of our water, particularly in our deep wells that are down to 600 feet or so, have high sulfate contents. That sulfate adds to the amount of hydrogen sulfide potentially that's going to be in that manure, making it potentially more hazardous. So be aware of that. When the pits warm up, this time of the year, those pits are kind of going to sleep. You take a temperature of that manure, that liquid manure, and the temperature is like 30, 40 degrees. It's not going to freeze up at that because there's a lot of salts and so on and so forth in there, but there's not much bacterial action. But when it starts to warm up in the spring, then those organisms start to wake up and they start producing a lot more hydrogen sulfide. And that's when we have problems, because that's when we're going to start emptying those pits. So prevention, minimal gradual agitation. You don't want to put your recirculating pump or chopper agitator or whatever you're using and give it the whole 150 horsepower right away. Very slowly, keep an eye on those pigs, don't be in the building, and just gradually start to agitate it. And if everything seems to be okay, then you can go ahead and gradually increase your agitation. But if those pigs start to act a little funny, stop right away and stay out of the building. And then that's when you need to start thinking about whether we're going to have a serious problem or not. And one of the ways that you can do that is actually check the pH of the pit. You can go to a drugstore and get what's called pH paper that we used back in high school, chemistry lab, put it on the end of a stick, stick it down in there, and if it's acid, if it's down in like the 4 range, pH 4 or 5, then that pit is much more at risk than is a pit that's up towards the level of neutrality, because the acid condition allows the gas to form as a gas and then will come out in that nature. So be aware of that. If you have a problem pit and you can't empty it without creating a health problem, you can add lime to it. This is slaked lime, not the barn lime, but the kind of lime that you would use to mix up concrete and so on and so forth. You can add about 500 pounds to an average sized pit, bring that pH up a little bit, and then it'll help you be able to empty that if you've got a problem pit situation. So those are things to think about. Agitation is the problem, plus the confined space is when you get into problems. And all of these different situations, that building up on your left there, 250 market hogs dead, almost killed the producer, very close to killing the producer. Inside a honey wagon, been death inside those, even in an open slurry tank like that. So whenever you have the possibility of a confined type space and agitation, that's when you have problems. Why does that happen? Does anybody think, what in the heck does the agitation have to do with making this a problem? I don't suppose anybody ever in here has ever had a bottle of beer or anything like that you've ever shaken up and put your thumb and tried to squirt somebody across the room. Nobody's ever done that, right? But anybody, I mean, assuming you never did that, but did you ever think, why does that work? Why does that work? It's the same thing as what happens with manure, why the hydrogen sulfide comes out. Because when you shake that bottle of beer up, what you're doing is increasing the surface area between the air and the liquid, and it allows then that gas to come out very rapidly. So when you agitate manure, you're doing the same thing. You're making waves, basically, and those waves are a lot greater surface area to allow that gas to escape. And that's basically the reason. There are some instances, too, if there's a scum over the top of the pit, you know, that will also break that up. But the main thing is increasing that surface area with the agitation. And the more agitation, the faster that hydrogen sulfide will come out. So be aware of that. As I say, in another couple of months, hopefully the ground's going to be thawed out, and we're going to be putting manure out on the ground. So we have to be, that's when the problem happens. Talk a little bit about noise exposure, because this is another health problem that's a chronic situation, because you all know that hog production's noisy. And so we've assessed the noise level in a variety of different kinds of operations, tasks within production facilities. Power washing is a big exposure. And back in the back or over here, can you tell me what level is hazardous? Anybody know? We measure it in decibels. Yeah, that's right. These are all. OSHA would say if you're having exposures of 85 decibels that you need to do something. If it's 90, then you've exceeded the limit, and you know that they can do things at that point. So you can see that there's a number of types of operations where that 90 is exceeded. We have a number of operations we've worked with that have instituted noise control programs, which are kind of expensive and time-consuming and whatnot, so you'd hopefully like to try to avoid that if you can, but we're kind of bumping up against a situation where it's kind of a challenge not to exceed those limits. And one of the, from the daily production kind of things, besides bleeding, processing pigs is, you know, it's a noisy operation. You all know that. So, and I don't have the list up here, but processing pigs is up around the same level up here of power washing, up in the 95 area. So, and then I want to talk a little bit about some infections that are of concern. Methicillin-resistant Staph aureus. Have anybody heard of that? Anybody? Anybody? What we're talking about? Well, let's just review a little bit of that, because we used to think that methicillin-resistant Staph aureus was a problem in hospitals, hospital infections, which it was back in the 1980s. That's, you know, in hospitals you're using all kinds of disinfectant and antibiotics and so on, and you create an environment for these organisms to adapt to whatever you try to treat them with. And so it resulted in some of these resistant organisms that has created a problem, you know, in hospitals. But then in the 90s, we recognized that it occurred out in the regular community as well. In fact, my son and junior high football, got a hip infection with the methicillin-resistant Staph aureus, almost lost his hip at tender age of 13. But it took 2 different surgical procedures to drain that hip and find something that would treat it and clear up that infection. And that occurred because he got a small cut, and the locker rooms, the shower rooms, the other facilities harbor this organism. It got into his skin, got into his blood, and then lodged into his hip. So we've recognized through the 90s a lot of different situations like that. And then, well, fortunately or unfortunately, however you look at it, in 2004, in the Netherlands, they found this in pigs as well, this methicillin-resistant Staph aureus, as well as dairy calves, particularly veal calves. And they had a number of producers that have acquired this particular infection. 2009, my good colleague at the University of Iowa, we found it in pigs in this state as well. And well, we don't really know what percentage of herds may be infected, but we do know if we find it in one particular herd, then upwards of a half of those pigs will be carrying this organism. They may not be sick, they just carry it. Does it cause a problem in people? That we don't know. We don't know. One of the things that we know, at least at this point, is the particular strain of methicillin-resistant Staph aureus that we have in our swine population so far don't carry the real virulent or nasty genes that make it want to evade and cause a lot of really nasty diseases in people. But it can cause disease with, it's kind of hard to see, but that is a methicillin-resistant skin infection. It may look like boils. It may be more of a diverse infection like that. But it's mainly a skin infection, and it can spread through the blood and cause other kinds of infection as well. But so far, we don't know if it's an occupational problem. We don't know if it's a public health problem. We do know that it can go back and forth between pigs and people quite easily. So maybe the people, or your employees that may be, or yourselves that may be carrying the organism, it may be the pigs, and you may be sharing this back and forth. We know it's in the showers of the shower in, shower out facilities. We can isolate it out of the showers as well. We're working with a situation looking at biofilters because we do know that we can isolate the organism in the air that's exhausted out of the buildings. And so we've been looking at using biofilters. You know what biofilters are? They have been used to try to cut down the odor that might be exhausted from the buildings. And our initial results show that these biofilters will trap the methicillin-resistant Staph aureus that comes out of the buildings as well. So that's we just really pulled this data up yesterday. We're working with a farm down south, production unit down south of Iowa City a ways, and some promising results there. So anyway, that's just a little bit to be aware of on the radar screen as to where that is. Something that we should wait and see. As I say, we don't know whether it's a problem or not, but it's something that we need to keep a handle on. Acute injuries, we've talked about getting injured from just from the animals or messing with the animals themselves and the costliness of that. And then I want to talk about something that we have been doing some research on in the last couple of years, and that's needle sticks. So how many of you in here, besides myself, have stuck yourself with a needle? Everybody does that, right? And I can remember one particular time I was synchronizing a whole group of sows to get them all bred at one time. And so on the last one of the last day, I was doing an ear vein injection, and I was tired, right through the ear, right under my thumb, the whole 9 yards. And I tell you, I was laid up for probably 3 weeks or so. So it's not uncommon. The thing to be aware of, I guess 2 main things to be aware of. If you're given vaccines, there are a few of them that will have an organism that's not killed. It's a live attenuated product. There's still a few of those on the market. There's at least one erysipelas product that is a live attenuated. If you happen to inoculate yourself with that, you can get erysipelas. Usually just a skin or a wound infection, not like what you see with a pig that gets really systemically sick. And the other thing is that what is in that vaccine to make it be effective. It's called an adjuvant. An adjuvant may be particularly, an adjuvant means it's assisting. If you translate it from the Latin root, it means to assist that vaccine to be effective. They can be a lot of different kinds of things, but they can be the major problem if you get an accidental inoculation. And not the actual agent itself, but the adjuvant. Ones that are mineral oil in nature or that has products from a mycobacterial organism, which is a killed product, but those things help the body to develop an inflammatory process and wall the immune product off for a while to release it slowly, so it's like giving a pig several different vaccines because it's releasing it slowly. That's how they work. But if we inoculate ourselves with those, particularly ones with mineral oil and those products, it can really be nasty. So it would be, those of you who are managers and whatnot, try to know what products you have and what is in them as an adjuvant. If you have somebody that sticks themselves with a needle and you got to send them to the doctor, give them the product label when they go to the doctor so they can figure out and see what it is. They may or may not know what to do with it, but at least they will know whether or not there's an active agent in there, that is a live product that can cause an actual infection, or just what it is. But again, that's something that we've been working on quite a bit, and we're trying to develop like a guide sheet for physicians at the emergency rooms and so on, so they know which products are harmful or can be harmful and what the problem is. And then another thing is we got a lot of women working in facilities now, obviously, particularly in the farrowing barns, and they use oxytocin and prostaglandins. I mean, very common things that are used, right? If a woman is pregnant, at probably any time during that pregnancy, if they happen to inoculate themselves with one of those 2 products, it can cause an abortion. So we need to be aware of that, and my recommendation is that pregnant women should not handle those products, period. Just to be on the safe side. Just to be on the safe side. Certified Safe Farm. This is a program that has a lot of similarities between the program that Jim talked about today. We started this back in 1997 and have data now on over 1,000 farms. These are not just swine farms. These are all kinds of farms. We have different products for different types of farm. We've got one for dairy, we've got one for grain farms, and one for swine farms as well. It encompasses several different things. On the left there, we train people to be able to go into a facility to assess that facility for health and safeness. And they have a checklist as well, working with the producer, but they're an outside independent source. As Jim mentioned, and I think we all are aware of this, we walk around our own homes with all kinds of hazards all the time, electrical or whatever it is, but we're so used to it, we don't see it. We don't see it. And if you have fresh eyes, and somebody who's been trained to be able to look at this, but understands the industry. That's really critical, to be able to go out and find that. And to actually assess the levels of gas and dust in the air. Very critical thing, too, to see where we are in that regard and what management procedures might be done to get them into the level that we would be more helpful for the pigs and the people. And it's a scoring system. You have to, if you get like an 85% on this, you get to be called a certified safe farm. You know, you get the plaque out in front of your drive, and this is the fact that can be two things that can add value to it. Number one, we've been working with OSHA and others to make this what's called a STAR program, so that if you become certified by this program, which they accept, then even if you have more than 10 employees, OSHA will not come on your farm unannounced unless there's a big problem. So you don't have to worry and look over your shoulder about them coming on your farm all the time. So that's one thing. And the other thing is working with insurance companies to get your insurance premiums rated if you are certified under this program. So those are two things that we're really working on. And there is a health component of this. So we have trained nurses who sit down and do very simple screening tests, what could involve hearing, respiratory screening, and to make sure that your employees are healthful, and that provides an awful lot of learning information for them as well. And then also direct education so they understand why gas comes out of a pit fast when you agitate it and what you could do about it to keep it from being an acute problem. So those are the things that we work with. We have a number of clinics, what we call AgriSafe clinics, that are really kind of the centers where these things can evolve from. A system of trained nurses and other providers that we've developed really starting back in the late 1980s that can help provide those services. And just a little bit of the results, percentage of people farmers who wear respiratory protection. This is the intervention group, those that have been on the Certified Safe Farm program, and this is on our control group, which are matched types of farm and so on and so forth, and just followed over the year. So we've been able to get that on people, respirators on people. We've been able to lower this condition that we call organic dust toxic syndrome. The blue, again, is the intervention, so it continues to be significantly less than what we see in our control group. We see improvement in respiratory conditions on these farms. Those that have measured below baseline levels at the start, and after 4 years, 70% of them are improved. And then the cost savings. And you can see that in terms of the insurance, that is the medical payments that insurance companies made to the Certified Safe Farms in the blue here per year, average over these 600 farms about $180 or so. Relative to those that are in the control that were not on the program, $332. That's per farm. So that's a fairly significant savings over the period of time from the insurance company. We think that the insurance company should share that back with those farms, those operations who take the effort into reducing the exposures and the health outcomes. And related to the score then, medical costs over here on an individual farm, the safety score. As I say, we require an 85% to become a certified safe farm, but the higher the score going this way, the lower their medical costs are. So it's a nice relationship that we've been able to see. So starting if you're, those that are way up here close to 100%, their medical costs are really quite significantly lower relative to back here that are in the lower end of that scoring procedure. So things we like to see. I mentioned at the beginning that we've worked with the Pork Board to establish some training programs for managers and for producers, and we have these all canned that you can get access to on the website. And see if I think I have the website on the back end here, but anyway, the goals of this training program is to enhance, obviously, very basic safety and health training in the pork industry to reduce the injuries, illness, and costs, improve regulatory compliance, and build a safety culture, and train the trainer so that the workers get trained. So summary-wise here, health and safety is the right thing, it's the economical thing, and it's the legal thing to do. And the big reasons, big things that I have talked to you about today has been more longer term, more health related, and that is respiratory, related to exposures of dust and ammonia, and the endotoxin is a component of that dust. Hydrogen sulfide, acute poisonings there, hearing, infections, and needle sticks. So that's it. Our job at Iowa Center for Agricultural Safety and Health, we just had our 20th anniversary this year. We're all about helping to keep farmers, their families, and workers alive and well in agriculture. And we are a center that combines our public health at the University of Iowa together with the Iowa Department of Public Health, the Department of Agriculture and Land Stewardship, and Iowa State University, and a whole group of nonprofit organizations out there scattered across the state to help keep farmers alive and well in agriculture.